My name is Lacey Strassner. I am the pharmacy technician clinical instructor here at the Sulphur Springs High School. Pharmacy technician is designed so that our students do a self-paced learning on the computer as far as the book portion of pharmacy technician, and then 2 days a week our students go to local clinical sites with several pharmacies here in town, including the hospital, and they get work-based hands-on training. Our students are trainee certified, so their certification is good for 2 years. They'll take their first certificate exam in April, and then they'll have 2 years to work under that training license if they don't pass in April, but we are planning on them passing. And then from that point forward, they would be a certified pharmacy technician, which essentially sets our kids up to at least go to college with one certification.
So when they graduate here, they could potentially go to work and continue learning.
Yes, and several of my students already have jobs here in the local pharmacy, so they're working part-time for them already. So they can essentially already go to work as a trainee pharmacy technician, but once they take their certification test, then they can work anywhere.
All right, and how many students do you have in this class?
I have 6 students this year, which is our first year to do this program, so it's kind of just taken off. 5 out of my 6 that I know have all been accepted into major university, and 3 of the 6 that I know, 2 of those are working in the pharmacy.
So they've already got a boost and are planning, moving ahead. Okay, all right. And what are some of the qualifications to get into this program?
So to get into the program, the students their freshman year take a starter course called Principles. Their sophomore year, they take a course of medical terminology. And then their junior year, they'll take a course called Health Science Theory, which lets them get a little bit of hands-on. They learn vital signs and kind of the basics of patient care. And then their senior year, they can come into pharmacy if pharmacy is something that they want to do. Some of them, I've got one that wants to go the nutritional route, so she thought pharmacy would be beneficial to learn how drugs interact with her patients on the nutritional side. I've got one that wants to be a pharmacist, some that have tossed around the idea of pharmaceutical sales, so it's not necessarily just being a pharmacist or a pharmacy technician, but helping them have that knowledge base of starting out just in the actual pharmacy world.
So it gives them that grounding to build on, and that there's several
there's several different pathways in the pharmacy world that they can go and do.
Okay, but this kind of gives them a good introduction and gets them started.
Yes.
Okay, all right. And is there anything else you think of that's important about this class to let people know?
Just that our kids have had major support from our community. Every one of the pharmacies that our kids have gone to are all people that live within our community, and they have had nothing but good things to say about our kids. So we're grateful that our kids are at least given the opportunity to do this.
So we have so there's lots of good community
There is
support.
lots of community support, yes.
My name's Katie Tiemeyer, and I am a senior here at the high school, and I'm in the pharmacy program. What else did we?
What made you interested in this program?
So I knew that going into the medical field, where I would be around like patient-to-patient contact with like bodily fluids, was not my department, and I don't think I could handle that. So I figured that the medicine route and knowing the kind of medication people need to take would benefit. Like she said, I'm the student who wants to go into a nutritional route, and so I figured that knowing medicine, no matter like what I learned from this class, would benefit the career path I wanted to go into.
And now are you working in town with a pharmacy? Or?
I don't currently have the job with a pharmacy, but I do the shadowing on a weekly basis, and it's a lot of fun, and it's a lot of good experience that I've learned.
Okay. What are some of the things that you've learned while you've been doing that?
I've learned, well, for starters, I've learned a lot of time management skills, and then I've learned how to package medication, how to read labels carefully, how to read the directions on them to know how to administer it, like in the right dosages and the right amounts. and just different types of medications and their classifications, like how dangerous they are and what level people will need them at. So just different things like that.
So it gives you a little bit of background, and if you decide, you want to apply that or that as medications would apply to a nutritional field, that's something that you feel like you're able to utilize.
Yes, ma'am.
Okay, and what makes you interested in doing nutrition?
So my family friend, we have a good family friend, and she is a certified nutritionist, and she's done a lot of work with both myself and my family, and she's made just a huge impact on our lives and just helping us figure out knowledge about how to fuel your body correctly and how to treat yourself right, even if you think you're eating enough and you need to be eating more, or like how to live a healthy lifestyle and while fueling your body correctly. So, and I just thought it was super neat, and she made a great impact on my life, so I wanted to go into that as well.
So you think you'll be a nutritionist, or?
I'm thinking more dietitian, but they kind of run a thin line, and I'm thinking like a sports team dietitian, so that I would work closely with like student athletes or people who need to be informed of how to fuel their body correctly so that they are the healthiest they can be.
So you want to help athletes and individuals to be their best.
Yes, ma'am.
Okay, and do you think that so far this class has been pretty helpful in preparing you for
Yes,
that?
ma'am, I do. I think that it's taught me a lot, whether it's going in the pharmacy clinic or being in here, because she's really good at teaching just life skills. And so I would say it's been super duper helpful, in that a lot of stuff that I learned on the clinic sites, whether it's going from like the hospital or to a branch like medicine chest where you're working more in the back room, and that's been a lot of information that I've learned is just from being back there and being hands-on and seeing how they distribute medication and how professional they are, and yeah, it's been a good experience.
Okay. And is it a class that you would recommend to someone else? Or?
Yes, I would definitely recommend pharmacy, especially if you're wanting to help other people and you're looking into the medical field, but you're not quite sure if you want to be hands-on with patients in that sort of way. Like, I guess I used to be like a germaphobe, and I was not prepared to handle throw-up or like body fluids like that, so I was thinking that this would be very helpful because I could just do medicine.
Okay. My name is Victoria Mejia. I'm a senior at Sulphur Springs High School, and I'm a student in our Pharm tech program. The way I got into this is I've been in practicum, or I've been in the health science endorsement all 4 years at high school, and I never quite knew exactly what I wanted to do up until last year whenever we began learning more about medicines. And like what Katie said, I knew I wanted to work in the medical field. I just didn't want to deal with all the bodily fluids, but I still loved working with people and still wanted to be some way of help. So I figured getting into pharmacy would be an interesting way to test another outlet, and I ended up loving it, and I'm still doing it right now. I actually want to go to school to be a pharmacist. I got accepted to go to college at UT Tyler, so I plan on going there in the fall. And then I also work at Cody Drug Pharmacy right now, so I have experience here that I'm getting from going to clinicals during the week, and I also have experience that I'm getting on my own time outside of school.
Wow. Okay, so you're definitely dived headfirst in.
Yes, ma'am.
Okay, so this program's been very helpful then.
Yes, it's opened a lot of doors to me. I actually got the opportunity to work at the pharmacy because of the shadowing that I had done, and so it definitely opened up a lot of doors for me, and it gives me a lot of good experience to go ahead and go into college with a good idea of what I'm getting myself into.
Now, do you think you'll be maybe working your way through school with
Yes,
with
ma'am.
that?
I plan on doing that.
Okay. All right. And you just had an interest in helping or in the medical field, but just weren't quite sure where.
Yes, ma'am.
Okay, well, it sounds like the shadowing was very, very helpful.
Oh, yes.
Okay, well, what do you like best about the program?
I think it's the hands-on that I like the most. You get to actually physically work with the medicines and, reconstitute or package them, but then you also get to see how you work with people in a pharmacy, especially at a pharmacy like Cody Drug. It's a retail pharmacy, so you work more with people that come in every day. And I'm very much a people person, so it just kind of makes it a little bit more real life and situational, to where you can see how people react whenever you're talking to them, and how to work with the pharmacist and the other technicians, and it's just a lot of good hands-on learning.
Okay. So you got a good feel of it, and definitely know this is where you want to what you want to do.
Yes,
and
ma'am.
the direction. Okay. Now, how much schooling will you have to have?
I believe I'm going to have 4 years at UT Tyler, and then I will go and do, I'll have to go to another pharmaceutical school,
Okay.
and it'd be about 4 to 6 years of doing studies in the field, and then just doing my master's.
Wow. So you've still got a ways to go.
Yes, ma'am.
So definitely something you have to be committed to.
Mm-hmm.
Okay. You ready for that much extra schooling?
Yes, I know it's something that I've set my heart on, and I think that with the right dedication and the mindset to do it, it's going to be not a breeze, but everything that you want is something that you have to work hard for and put work into.
Okay. Well, is there anything you can think of that's important to let people know about this?
This is our first year doing it, but so far I think it's a great program. It's already opened up a lot of opportunities for all of us. We have a great teacher who, like she said, we have a lot of community support, a lot of school support, even, parental support. And so there's just so much potential for this program. So I think watching it grow is going to be a really good thing to see for our high school and for the community.